Well, good evening. Good evening. Welcome. I'm so glad to see you here this evening. My name is Beth Paz. I am the Director of College and Young Adults here at Lake Avenue Church, and it is my delight to welcome you to the kitchen table. I even wore my shirt with kitchen chairs on it just because I got really excited that we get to pull up a chair tonight, okay? So welcome. You are in a place where we are engaging conversations of science and faith. That we can be a family that talks about stuff in the warmth and the security and the safety of the kitchen, which is really just one of the best places for these kinds of conversation, because it leaves room for us to take a deep breath, to engage over food or coffee, which we will at our break time, but then dive back in to some of the hard stuff. And so we invite you to pull up a chair, lean in as we engage this kind of table with small talk and big conversations. Last time we talked about science and faith, and we are continuing that in welcoming a panel that is really gathering around the topic of COVID and its continued impact around us. Every single person here has been impacted in multiple ways. And we want to talk about how we carry the weight of this impact within our own lives, within our own families, but within a family that cares about the larger community in inner cities. So we're going to invite our panel to share and introduce themselves. We are going to have a time where they share their stories of really grappling with the effects of the pandemic in their professions and in their personal lives. We're going to take a break where we invite you to bring your questions, and then after our break, we'll get into a time of Q&A. So may I please pass off the mic to Emily, and she is going to introduce our panel. Can you guys please give a warm welcome? Welcome.
Thank you, Beth, and thank you all for being here. I know that we are competing with a Dodgers game, so thank you for being the faithful. We are so excited that you are here. We have amazing friends and colleagues here that are really a wealth of expertise and life experience. I am Emily Rose, and I am an emergency physician. And I've been, sort of on the front lines of taking care of patients with COVID, but also, I feel like one of the benefits of being in emergency medicine is that I kind of get to see the society, have my finger on the pulse of what's going on. And more than just in the virus, I've seen so much heartache and people really struggling. I've seen people struggling, had increased stress and mental illness and substance abuse and all sorts of interpersonal violence, really unprecedented numbers of that as well. Because the pandemic, all of the results of this stress, it impacts us and our whole person. And we wanted to talk about these issues today because all of us are struggling in some way. And we have expertise here to talk about sort of how do we live life, how do we live life and life abundantly, live it to our fullest. So we are definitely part of that is our physical health, but our emotional, our social health, our psychological health. We are really multifaceted and all of it is connected. So we are each one of us is going to sort of discuss our careers and what we do, but I will briefly introduce everybody. First we have, to my left here, we have Kidest, Babi. She is a nurse practitioner at Los Angeles County USC Medical Center, and she has been working for over 20 years in our geriatric clinic. And she has a lot to talk to us about. Her experiences, as you can imagine, our most vulnerable population, not only to the coronavirus, but also to the impact of isolation and lack of socialization. Really just, we are all connected and we need that social connection for success. And then to my right, we have Cliff and Joyce Penners, and they are certified sex therapists, so they can teach us a lot about intimacy. Cliff is a clinical psychologist and Joyce is a clinical nurse specialist. So they have a lot of helpful tips just to help our connection personally. And you already know me, so without further ado, let's go ahead and start with Kidest.
So my name is Kidest Babi. As I said, as I was introduced, I'm a geriatric nurse practitioner. I've been working for the county LAC-USC, the most vulnerable population for over 20 years. Just to give you who I am and my background, I was born and raised in Ethiopia. I immigrated to the States about almost 30 years ago, so you can figure out my age. I went to school at UCLA, Cal State LA, and a doctorate degree from Azusa Pacific University. Mostly concerns, my doctorate degree is concerned or is focused on chronic disease management, so hence the geriatric population. So I deal mostly with diabetic patient, hypertension, chronic heart disease, lung disease, and I'm also involved a lot with the elder abuse cases for Los Angeles County. I've done that work as elder abuse expert for the last 20 years. So we see so many horror stories, and we deal with a lot of stuff. So I think post-COVID, or with COVID, that is more exaggerated, or we see the home dynamics, we see the fragility of who we are as people. The spiritual aspect as well comes in the picture. Finances come into the picture. So as we deal in the healthcare, there's what they call health determinants. And usually our health is not just the fact we're taking medication. There are other issues, our social economic factors that affect who we are or that determine our health outcome. So that's what we see. Coming back to here, this is an introduction about me. I actually got married at Lake Avenue Church in the chapel 20 years ago. My husband is Sega Werku. He's the director of counseling ministries here. We have two amazing daughters. Our firstborn is Grace. The second one is Meron. So I say my home life is very rich. I think for me, I would say boldly, the work environment and the stress, when I walk into my home, that is my, my respite or my solution, or where I get my solace as my home. I guess that's what I'll say.
Great, thank you.
So we are Cliff and Joyce, and you may wonder how on earth we became sexual specialists. We wonder sometimes too. We are known as pioneers in bringing healthy sexuality into the church and the Christian community.
And that all really began right here at Lake Avenue. I was in practice as a clinical psychologist, having graduated in '71, and this is in 1975, and I was asked to teach a class of mothers how to talk to their kids about sex right here at Lake Avenue. It was even pre-MOPS days. And so I thought, well, I've got a couple of kids, that'd be a good thing for me to learn about, so I studied up on it and gave a nice little talk. And a couple of days later, one of the women who had been in that group approached me and asked whether I would be willing to teach a class of 60 women who were wives of seminary students at Fuller, a class on sexual adjustment in marriage. And because there were going to be 60 women, and I was not an expert in this area, and Joyce was
A nursing professor. I taught at Cal State LA for 8 years and was actually in the process, I was in charge of the curriculum development for starting the School of Nursing at Azusa. And I was very busy, so when he prevailed upon me to teach with him, I thought, I can't do one more thing, but we did, and we're grateful that we did, because it became clear to us very early on that we could make a difference in helping singles accept and embrace their God-given sexuality and manage it in a healthy way, and help couples develop a mutual sexual fulfilling life in their marriage.
So because we were becoming known in this field, we quickly got some training in it to have our expertise catch up with
What we were being
what we were doing. Because we didn't know very much at all.
It was clearly like God was either pushing us or pulling us, I'm not sure which, and I was kind of always holding back and saying, I wasn't prepared for this, I don't know how to do this, and Cliff was always confident in saying, we can do it, and so we moved ahead.
Before the pandemic, what we've been doing then since 1975 are a series of things. One of them has been teaching seminars to individual groups like date night here at Lake Avenue, or that second half of the slide, seminars for married couples, Friday night, all day Saturday, all over the US and actually all over the world.
And the evening ones were just like one evening, but the couple seminars, Discovering Greater Passion and Intimacy in Your Marriage, were usually a 10-hour seminar, like Friday evening and all day Saturday.
Then another thing we did was, and do, is teach premarital classes, and we've done that here forever at Lake Avenue. In fact, we've now had people come to us who are taking the class, and they'll say to us, oh, we told our parents we were coming to your class on preparing for marriage, and the parents told the kids, oh, we went to that class. So that tells
That shows you how old we are.
How old we are, speaking of age. And so we've done that a lot.
And then something we really enjoyed but haven't done much recently is our parent preteen weekends, usually for 5th and 6th and 7th and 8th graders. And the kids bring a parent or both parents, and we present, and then they answer questions and discuss with each other, and that's been very rewarding. And then MOPS, we continued that and have been asked many times to teach MOPS, and I do that more now myself.
That's more throughout Southern California,
Right.
Not around the country.
Right. And
then on the next slide, the other thing that we've done a lot in recent years is training pastors and therapists around the world to deal with sexual issues. So I think on the top right, that's a picture of us teaching in Singapore, and the bottom right is us teaching in either Switzerland or Germany, and those are our translators on the other side. And so what has happened is that in recent years, much of our emphasis has been on training other helpers.
Which has been great for us, because when we started, we would get calls for help, and we didn't have anyone that came from a Christian perspective that was trained as a sexual therapist, and they just couldn't get help. And we still have people that we reach that way via telephone or elsewhere, because, and literally, we work with people in Russia and Norway and many different places where they cannot get the help.
The other thing that's going on, well, during COVID, we didn't have any speaking engagements in person.
It shut down like that on March 2020.
And we did some podcasts for some churches, and then did a whole day of training for the Australian Association of Christian Counselors. So that was kind of fun. But just recently, we had our first speaking engagement in 2 years in Orlando at the American Association of Christian Counselors, where we were, again, training other people. And in 2 weeks, we'll be in Atlanta at the Institute for Sexual Wholeness, which is about training therapists to become sexual experts. And we'll be doing the master class on that. So that's what's happened professionally for us during COVID. We're still continued to do telephone therapy and Zoom therapy, and are now starting to get back in person.
Vital to our lives are our faith, our friends, and our family. And our faith started out in German Mennonite communities, and we always say, if you know anything about German Mennonite communities, we would be the last ones to be expected to be sexual experts. I literally didn't know a thing till I was in nurses training at 19. So it was not something talked about at all. So, and at an early age, we, as the words were in our culture, invited Jesus into our hearts. And so and then we came to Fuller and Lake Avenue.
That was in 1965, and the first church we really attended was right here, where we joined the young couples group that is now Disciples.
Some of you are here.
But that was then just the newly married. Most of them didn't even have kids. And so we've been involved at Lake Avenue since 1965.
And our friends have grown really, as our lifelong friends from those early years at Fuller and at Lake Avenue, and then has broadened into our neighborhood and community.
And then our family has been very important. We've got 3 kids, 3 married with 9 grandkids. And that's our family taken, about almost
year and a half.
Year and a half ago.
Uh-huh.
Yeah.
And we are 17, but they're 18 there because, I don't know whether it's on your, back to the previous one. On the far, is it the far right or far left for you?
It's a far right.
Okay, is our oldest grandson, and that is his fiancée. And so we will be 18 soon. So
but
that's fun.
Just for those of you that are in this world, once your grandkids start getting married, you know you're really old. And so that's what's happening for us. And then on the next slide, we have our 2 little ones who are 4 and 6.
And then
they're right here. They live right here in Silver Lake.
They're the only ones who have lived close. The others are in Chicago and Northern California. So we spend a lot of time with them, and their mommy is a physician, a surgeon. So many times Grandma gets called to help out when she gets stuck in surgery and doesn't get home in time, or things like that. So it's lots of fun.
That's our story.
That's great.
Yes.
That's great. Thank you so much. Well, I will tell you a little bit. I saw that you ended with family, so my slide starts with my family. I am relatively new to Lake. I've been here for just about 5 years or so, my wonderful family and I. This is my family, my awesome hubby, my truly better half. We met in seminary, went to seminary before medical school. I did not finish my degree. We met at Gordon Conwell Seminary, and I got teased by a lot of my classmates because I got my MRS degree at seminary, but not an actual master's. But I met and married my husband there. And we have 3 amazing daughters. I love the picture up there, I guess on the upper left is my 3 daughters with their belt of truth on at Sunday school at Lake Avenue. I think a year or so ago, I thought that they were very proud of that. And it's in some ways, the last year and a half has been some of the best time of my life, and some, obviously very difficult. But we've had a really great time being together as a family. My husband and I have joked, we got married right before I started medical school, and then I did 4 years of med school, 4 years of residency, 2 years of fellowship, and then my last month of fellowship, I got pregnant with our twins, and we had 2 kids in 3 years. So we actually, during the pandemic, were like, wow, we really got to spend time together for the first time, really, it had a lot of fun. We had lost our wedding video, and we found it. That was the good news, but the bad news is it was on VHS, and so we no longer have a VHS player to watch it. But next slide, please. So I sort of have 3 jobs. I have 2 official jobs, but the next couple slides just kind of will go over what I do. So I'm an emergency physician at Los Angeles County, USC, with Kidest, same hospital that she works at. And I have the best job in the world. I really love what I do. So I work in both the adult areas and in the pediatric areas because I did specialty training in pediatrics. And we see, medically sick, traumas. I've delivered, just the other day, I delivered twins in the middle of the night and then had to, resuscitate the babies. And then I also had an 108-year-old patient. So I really love just the variety, the spectrum of life. And I love the opportunity just to be with patients in this difficult time. Nobody expects to go to the emergency department in the morning. I already mentioned that in some ways, we've just seen so many patients I've seen thousands of patients with coronavirus, but I've seen so much heartache, in so much substance abuse, so much mental illness. I've had numerous young children commit suicide, just so much, just really despair in society. And so that's been very difficult just to witness, and I just have a heavy heart for the pain that people are in. Another one of the aspects, part of my job is to teach residents. We have 80 residents that are training in emergency medicine in our program, and it's so fun to get to know them. They spend 4 years with us, and I really, I actually cry at graduation every year because I get so attached to them. I really love them. And, I really develop good relationships with them. I hear from them often after they graduate, which is a lot of fun. There's a couple pictures here. The one on the lower right, all the ladies up there, on a shift, we noticed that it was there was a big team of all females, and we were so excited about it. So we ran up to the helipad and took a picture of us. It was a ladies' night in the emergency department, we said, which was a lot of fun. But one of the things, specifically talking about the impact of the pandemic, is we have such a great community and culture and family in the emergency department and with our residencies. Because it's a county hospital, we have, we're caring for the most vulnerable, the marginalized. We have a lot of homeless patients. We have a lot of, immigrant patient families. 80% of our patients don't speak English primarily. And everyone that comes there is very mission oriented. They're there because we could get paid more and work less at any other hospital. But we're there because we really want to care for the population, and we have such a great community there. But it's been hard, our residents, I've seen them struggle more than ever in the past year and a half, because I think it's a combination of many things, but the isolation, them not being able to see their families, and not being together. We weren't able to do retreats. We'd have class retreats and spend a lot of time together in person, and they're not able to form those deep relationships. And there's actually been more interpersonal tension than I've ever seen, which is really hard to go through. And I keep saying, some of our junior residents that I usually know so well, I don't know if I'd recognize them without a mask on. So there's that, distance too, which has been unfortunate. So that's one part of my job, is working in the emergency department, which I really love. And to be perfectly honest, I actually signed up for a few extra shifts when my kids were at home, just to get out of the house sometimes. I was like, I was glad I still had a place to go. I love my family, I love being home, but it was nice to, take a break and go, volunteer in the COVID unit. All right, next slide. So the other part of my job, this is a lot of fun too, is that I'm employed by the medical school. I'm 50% with the medical school, and what I do through the medical school is I run an undergraduate pre-med, pre-health program, and I teach a couple of classes, and we sort of get to do fun sessions and panels and things at the undergrad USC campus. And so these pictures are, I think most of them are pre-pandemic, but I get to, through this, I get to talk to pre-meds, undergrads. I teach one class on sort of introduction to what is medicine, what are the core concepts, what do you need to know. We talk about things like medical ethics, and then I also have a class on professionalism and, what does it take to be a physician? What does it take to, have integrity and personal development, basically resilience and grit. It's a lot of fun to teach those classes. I invite a lot of my friends to come in as guest speakers, and we have panels, and it's really fun to connect students to role models and mentorship. And then I also have worked through Keck to create a program that targets specifically first-generation college students and those from lower socioeconomic status, as well as underrepresented minorities. And we're trying to really pour resources into supporting them just to, increase diversity in people that come to medicine to care for particularly vulnerable populations. And so how this has been, the pandemic has been interesting because for over a year and a half we had to teach online. We weren't allowed to do in-person classes. And that was tough. Because, and it was tough to see my students. They were very, they needed more. They were really lonely, felt isolated. A lot of them were starting college, and this is not what they expected. And there was a lot of students that in not just my classes, but other classes too, that sort of fell off the radar. They just stopped coming to class. They didn't turn in their assignments, and the ones that we heard of, well, they had 2 deaths in their family, or they had to, their parents lost their job and they had to move, or they had to withdraw from USC. And I mean, all of these stories were really, it was really just tough to see sort of other people's lives falling apart. So that was an interesting experience. Thankfully, this fall we're back in person, and it's a lot of fun. These students have never been so interested. They've never been so engaged. I mean, they're asking all sorts of questions. It's a lot of fun. I think they really appreciate just the opportunity to be back in person. All right, next slide. This is my last slide. Okay, good. I'm not talking too much, or maybe I am talking too much.
No, it's perfect.
I don't want to go over time. So sort of the third part about what I do is I do a lot of education. Because I trained in pediatrics, pediatric emergency medicine, I do a lot of education on the care of children to emergency physicians. So general emergency physicians can take care of children, but it's often sort of an area of people describe having a knowledge gap or less comfort taking care of a sick kid. So I've done a lot of just extra curriculum. I've written a textbook. This is sort of funny. I worked really hard with a big team of people to write a textbook for emergency physicians on pediatric emergencies. And we had this tight deadline to release it right before our big American College of Emergency Physicians Scientific Assembly, in October of 2020. And we made that deadline, and it came out. It came out on October 1st, and we worked really hard, but of course there was no scientific assembly for it to be released at. So I'm leaving in 2 days to go for a very abbreviated assembly. Hardly anyone's gonna be there, so it's still, yeah, it is. We plan, right? So we try all these things. But it's been a lot of fun to prepare, be a part of planning these courses and traveling with courses. I travel quite a bit, but I had, I think, 8 conferences canceled in the first 6 months of the pandemic, which bought me a lot of time. We cleaned out our attic, we cleaned out our garage. It was wonderful. So that was good. I think the silver lining of things has been that we've transitioned a lot to online. So last week I lectured in New York and Michigan, and a couple weeks ago I lectured in Pakistan, all from my office at home, which was wonderful. It was, it took me, my commute was wonderful. No delays at the airport. So that was really nice. It's nice to have just the increase in access and the connection. And I actually connected, I have a tutor, a Spanish tutor in Guatemala, and we get to just connect very easily. So I really am grateful for the technological advancements. So.
Good evening and welcome back to the kitchen table. I'm going to call you guys in and get your attention. We are so excited to dive into our Q&A session. So pull up your seat. We have some awesome questions presented from our attendees this evening. You know, the first thing that I think of as I receive this information is this has hit home in so many ways for so many people so deeply. So this is a real family conversation that we need to get into. And it's going to be hard and good, but it also, the depth of your hearts, even through your questions, is very telling. This has been a trying season. So let's lean in, let's have some discussions, and also some fun. Let's just talk about the impact, okay? Interpersonally, in the workplace, and within our families, there's a lot of questions around how have you been in impact, how have we been impact and dealt with the divisiveness of COVID, just in general, within our own lives, families, and workplaces. Let's start with that and move it inward.
I can start. For me, I think the way I dealt with the last 2 years is a lot of prayer. I'm involved with several prayer ministries, locally, internationally, in Africa, and different parts of the world. We have a Zoom prayer line. Sometimes it goes for hours. And really actually praying for the world, praying for the suffering, and praying for the needy. So it really helped me to look at myself and what is really a priority in this world as we live. Of course, we have a profession, we have family, and where does God fall into this? So I think the whole crisis, the whole COVID, for me personally, brought me way much closer to God. I haven't lost any closer person due to COVID with this experience, but it really made me really, in a very tangible way, to be in touch with the spiritual realm and to be aware. That is for me. And work-wise, as I told you earlier, I work with geriatric patients. These are very vulnerable population with several comorbidities. The patient population that we deal with is really underserved. So it was really very difficult for so many. Within just our clinic, we lost over 45 patients. Wow. And these are like patients in their 90s. It was very touching. There are also in their 90s, 95, who recovered from COVID. So unless it's God's timing, whether I don't think you would go because of the age. But this population, I feel like, was really impacted. The other big impact that I saw in the county of Los Angeles, the food crisis. So the county had a food pantry for any patient population to come and get groceries. And it was not unusual to see people 500 plus every day lining up for food and for groceries. So I could see that our population is very fragile, and for people not having food at home and lining up for hours, and then the hospital devised a system where they can come, still now is going on, every other week on Wednesdays to come and pick up groceries, so they could feed themselves and their families. So I could see the fragility of the population, the vulnerable population. And then the other aspect that I could see is now, we're pretty much the initial phase of it, we're seeing patients via video, via telephone calls, just refilling their medication and trying to see how they're doing. But now COVID is over, some patients are still traumatized to come and get medical attention. They're like, oh, no, 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 I'm not coming. They would give every excuse. And some of these chronic patients or chronic diseases, if they don't have diabetic medication or hypertension medication for months, by the time they get to our ER, they're really in dire stages. So we lost the preventive side of caring for them. So that's what I experienced at work, and it's still going on.
On our side, as you can imagine, it was mostly dealing with interpersonal issues. An example might be a good one where I was working with a mother and daughter who were, adult daughter, who were massively alienated because when the daughter insisted on wearing a mask when they were together, the mother took this as a sign of the daughter not loving her anymore. And now you're trying to help people who come from a different way of thinking, each of them, as is true out in the world, to bring their former love and acceptance and care for each other back into it. And those have been the kind of issues that we have dealt with.
And I was thinking of another one where like I have a sister-in-law who's in a nursing home, and we have a friend whose mother is in a nursing home, and for 18 months, they weren't able to receive visitors. And these are elderly people, so lonely. And you can do FaceTime and other things that are helpful, but not having the touch and the connection is really difficult and painful.
So we know that it's gone from these interpersonal levels to our communities that are feeling the fragility in the ripple effects, all the way through food insecurity and other continued medical issues. But what would you say, let's just kind of linger here for a second, for someone who just feels like the last 18 months have been, they've just been so different because of these uncertainties, the restrictions, and there has been a mental and social toll that has affected me in ways I'm unfamiliar with. What can I ask myself? What questions could I evaluate how to understand my well-being?
Well, the first place I would be interested in going with that person would be to try to understand what part of them this has touched that was already kind of latently there, but then the COVID experience brought it to the surface, and understanding what that insecurity is about. And that can be insecurity in relation to God, like God has forsaken me.
Or why does God allow this?
Yeah, and so it becomes a crisis of faith. It can also be, why have all the people around me deserted me? I can't get the hugs I need. I can't get the connection I need. And then it kind of moves into depression. And one thing we know about a crisis is that when the crisis is past, people have either moved in a healthier direction or have deteriorated in their emotional mental health. We're seldom at the same place as we were. And so what it tends to do is bring out the stuff that is undealt with in their past, usually.
Absolutely. I'm going to continue with this question. So what are some basic daily habits that you could recommend to build our health post-pandemic?
One thing that's so important, and everyone may know that, but I still want to keep emphasizing, is sleep. Getting adequate rest and sleep is so important, particularly when we're struggling with a crisis or depression or with emotions getting stirred up, and then sometimes it's difficult to sleep. So making sure you can get rest, getting good nutrition, which may just sound redundant, and having people to talk with, having people that you can just share it with who aren't just going to give you a pat answer. It's great to pray for you, but you want more than that. You want to make sure they really hear you and listen and are there for you.
Everybody needs an ally.
Yeah.
There is so much, I say this all the time to my residents as we're, taking care of patients that are coming in with, chronic, back pain, knee pain, or whatever, even a lot of chest pain. So many physical problems that we have really could be certainly cured, completely prevented, but even chronic disease is made better by these very sort of common sense. Everybody knows they should sleep well, eat well, exercise, but do we do it? No, but I mean, it's tremendous how powerful, our bodies, our minds, it's all connected, and like Joyce mentioned, sleeping well, making sure to be very diligent about prioritizing that, and eating well. Exercising. Exercise is so important for stress relief and perspective, but also well-being and health. And it is a great way to battle depression, and it gives you more energy.
And meditation, the
Yes.
prayer.
And doing something.
Sometimes I really need to check myself. Do I really know how to get into the presence of God? Do we really take that ability to connect with Him, or do we just say our prayers? And that ability to get into the presence of God and being mindful and meditating.
The stressors have really been immense. I mean, I think of some of my young adults, universities close, our living situations are changing. Why are we paying rent over here if we're now working remote? We've moved. We're adjusting to not having coworkers, or we have coworkers in workplaces. For instance, this person who is in a medical practice, and they're experiencing similar things with staff, as you mentioned, heightened stress, heightened increased conflicts.
Lack of grace. Lack of grace.
Right. So how do we handle some of these stressors that have come up in terms of both, not just our own lives, but in our workplaces?
Just to add on what we talked about or what Joyce has mentioned, exercise is very key. I know as medical providers, we sometimes say, oh, you need to exercise. But some of the tips that I give my elderly patients is, if you can do just 15 minutes a day, and that's one step. And then maybe if you're able to tolerate that the next week, you can add 5 more minutes. And it would be a progression, like nobody's expecting you to be exercising for an hour or 45 minutes. So little steps, little changes in lifestyle would make a big impact over time. So I see that for myself, even when I'm really stranded, just going out for a walk while I'm praying. I do that so often.
But when I'm depressed, then I don't want to exercise.
Now what?
Yeah.
Right.
So then that gets us to dealing with what are the barriers to doing the very things that we know would be good for us. But just had somebody say that to me today. I know I should be doing this, but I just don't have, I don't have it in me to even get up and do it.
Yeah.
And that becomes a real barrier, and then it usually requires somebody on the outside to help us, either come alongside, get counsel, something.
And we can all do that for someone, whether we just give a call, take somebody out for lunch, be there for someone.
Go for a walk with them.
This is part of what is our role as Christians during the pandemic.
Yes.
We are carrying significant weights ourselves in our own families, but we don't only care about ourselves. And I can tell you, I have had some really key moments when someone texted me about, hey, I'm thinking of you and praying for you today, or I specifically wanted to invite you to go on a walk with me, and it lifted my spirits. And I'd say this as someone who has had to engage all of these for myself. My mental health has been an incredible struggle during this season, and I started medication for that, and I started therapy, and I have a prayer partner. I mean, it was like calling on all the resources so that we could move forward. And I am just struck by, you guys, it's almost back to the basics. Like, you gotta move, you gotta drink water, you gotta go to bed, okay? So I receive it, we hear it, but even those things, we're saying we're taking ownership of our health, and somehow this massive pandemic comes down to, what can I actually control here? A few things.
Yeah, I just read one simple thing just the other day that said, if you're a person who sits a lot, whether it's your job or whatever, get up and move for 10 minutes every 2 hours. You know, just make sure you get up every 2 hours and move. Do something.
Yeah.
And these things sound so simple, but I can't tell you how many people tell me they have a hard time doing them.
They know they should.
So we need to call on each other and encourage one another in that.
I would say, I like that how you brought it up. Something that is really helpful, I think, when I'm sort of feeling like the world, you know, kind of down, you know, sorry for myself or whatever. Especially one of the things that I like to do when I go to work too is just to remind myself it's not about me. It's not about me. And when you actually are sort of wallowing in whatever it is, but if you step outside of yourself and do something for somebody else, man, like, do it selfishly, because that makes you feel so much better. You kind of get out of yourself and your world. And back to the original question about workplace tension, it's tough, you know, and we're all human. Oh man, and we all have short fuses. And I have a shorter fuse. I think we all do if I haven't slept, if I haven't, you know, ate well, if I have tension with, you know, a personal relationship, you know, I just don't have the reserve. But the more that we can to, like, just, if somebody's having a hard time, reach out to them, and not in judgment, but loving. And we as Christians, we should be distinguished from this world by our love and our grace. And as much as we can to not add to it, to not, you know, just, I'm not gonna get, you know, not be one to be easily offended. Just constantly, you know, grace, I think, should, we all fall short. But thankfully we receive grace for that. But that really should be, you know, all that we do should be done in love. And James, like, let us all be quick to listen, slow to speak, and slow to anger. You know, that's something, you know, we think about quite a bit too, just being an agent of love and acceptance and grace as much as possible.
I want to just say that the slow to speak, we often think we're going to help people by giving them advice. Rarely does it make any change in their life. We feel better because we've given them this gem.
That was very wise.
But it doesn't change anything. What changes people is when we can come alongside them and they can experience us as their ally with them rather than directing them.
I see you, I hear.
We get with them as in the way that Christ gets with us.
Yeah, the other thing I think in order to add to that is doing something good for somebody else. The idea is not to talk about me, but what I did the last 2 years, I have very important elderly people in my life, 2 of them. One is in her late 80s, the other is, he's not driving long distance. So I made sure, like, I enjoy cooking. So what I did is every Saturday after I cook, I separate some portions for them and just drop the food to their homes. It was so satisfying for me. And they had some home-cooked meal that they would enjoy. This elderly man used to tell me, I still do it for him right now, he would save the food because he's really savoring it for 2-3 days. So it gave me a lot of satisfaction. Instead of watching, I'm doing something about it. Something that we can do. It could be grocery shopping for somebody else. If you enjoy cooking like myself, just cooking something or giving them a ride. So instead of just looking at the bigger problem, as one person, what is my impact towards the community or towards any other person? That was huge for me.
It's good.
I'm going to move us into some of the harder questions, continuing with the theme of grace and love. I have friends and family who do not want to get vaccinated. What do I say to my family who have strong opinions about vaccination that are different from me? What is your opinion on the vaccine and mask mandates? So would you guys speak a bit to some of these more controversial
Let's
questions?
turn to the doctor.
I have to go.
You're needed in emergency, right?
Yeah. This is tough, and I think really as Christians, one of the things, this is heartbreaking for, I think everybody struggles with this, no matter how strong you are on opinions, or if you're here, there, or in between. It's really heartbreaking that we as Christians have so much division over this, and we really should be known to the world by our love and our grace. I think that's my main point on this. I knew we were gonna, Pastor John wanted me to talk about the vaccine, and I was like, oh, I do not want to enter this topic. Because I think it is complicated. On one hand, I mean, I'm a physician and I care for, I'm a pediatric trained. Vaccines historically have absolutely saved lives and made tremendous impact. I think that right now there's so much more. It's not about the vaccine, it is, but there's so much more to it. And I think that we have a lot of political issues, mandating issues, that I think that everybody has legitimate concerns. Just like I think Cliff, I think you're going to be mortified at my inarticulation of this, the classic psychological picture where one person sees an old woman in the picture and then another person sees a beautiful young woman. It is the same picture, right? And I think in so many issues in life, who is right? Well, the people that have issues and the people that want the vaccine, everybody to get it for good reasons. But the people that have issues with it also have there are some legitimate, concerns, and we should all be discussing about it, but it's the same picture, there's truth, and there's difficulty and struggles, and I think we as Christians should be, above all, gracious, and listen to, concerns. I think I certainly have, I think, getting as being an American and freedom of choice, I think there are some issues there, and we're also in a pandemic, and if it was, there are some issues. Anyway, I'm blathering on because I'm skirting the issue, skirting the question. Do
you want to speak at all to understanding the booster shots and what those, if those are recommended, or your take on understanding?
Well, I don't know that I would, I have a specific, from what I do, my expertise regarding the boosters, right now I believe it is officially recommended for those at higher risk. I would say as a pediatric trained person, one of the things I've done, I've actually I've written on COVID in children, and I've written on some of the complications of COVID. I do have some concerns with the process of rollout, particularly in California, with the risk versus benefit ratio in children who do really well with COVID. I think we need to have these kind of discussions on specific indications and personal choice. Unfortunately, we do have issues with the vaccine. Unfortunately, we are still able to, I'm vaccinated, you're still able to get the infection and transmit the infection. So I think that we still have a lot of things to sort of work out, and a lot of times it takes really time to accrue all the data and risk versus benefit, and what did we do well and what didn't we do well.
One of the things I think we don't have an answer to is how to understand how this has become such a political issue. I mean, seat belts never became a Republican versus a Democrat issue. Yet we're all required and we all do it. We could say that takes away my personal choice. But so it really complicates it that it's become a right and a left thing rather than what's the wisest thing, what's the best thing for the greatest number of people, that kind of thing. So that we don't have an answer to.
Yeah, no, and well, this is an honest, the accuracy of the data, the reporting, and you see, there's just a lot of information out there. Who do you trust, and conflicts of interest, and that's the challenge, and the truth will come out eventually. I believe in truth and integrity, and over time.
So even within my own family, I have the whole array of opinions within my own family, and that causes, emotional and relational distress and tension. So any thoughts on how we carry on these conversations when there isn't a pat answer, that's right in front of us? How do we engage these well?
I think it's always helpful to express, rather than saying what you should do, this is why I've made the choice I've made, and I don't want that to affect our love or care for each other, but it's important to me. So that rather than judging the other person, and I've had people shame me for having gotten the vaccination, or for wearing a mask. And that really hurts from other friends who are believers, where I don't want to do that to others who haven't gotten it, even though I care for them and think it would be beneficial in our age group. So, especially when there are health issues.
I think I have the same opinion, whether people are vaccinated or not vaccinated, to accept their choice. I cannot enforce what I think is right on somebody else's. But to see the other person as God creation and to value who they are and their opinions, it becomes very tricky in the work environment, because now, unless we're vaccinated, we cannot go into the workplace. But in our relationships and friends and family, just accept who they are. Don't be judgmental.
Where it gets difficult, though, is we have a sister and brother-in-law where he's very compromised health-wise, and one of their children and her family aren't vaccinated, so they can't get together because it would really be dangerous for him. And that's where it gets complicated. How do you say, I really love you, I wish we'd get together?
I really love you, but you can't come to dinner.
Yeah.
Kind of thing. That's where it really calls for an incredible amount of grace.
With a lot of respiratory issues.
Life is hard enough without these issues on top of it.
Yeah.
So then we all have some concerns and maybe even some fears about life through and after this pandemic. What would some of your fears or concerns be out of these multiple layers of ripple effects that we've encountered?
First one that comes to mind is that these divides will stay even when the pandemic has passed, because the
hurts will be there.
We are in such a divided world, and that the hurts may continue to be barriers between us. That would be my greatest concern relationally.
I said even at the beginning of the pandemic, I worry about just what's happening, to my profession. Physicians just feel like they have lost respect, control. They're confused. Some things are coming out. They're sort of, oh, we should be doing this. No, wait, we should be doing this, and feel like a sense of loss of autonomy, really, and a loss of, never before has the care that we provide been so dictated and micromanaged in a way, and it's leading to just a lot of sense of, depression and a sense of helplessness and a feeling like, well, if I'm supposed to just follow these algorithms, like what's the point of my 10 years of training? A robot could do that. So I think that's a challenge, and also just all of the persistent divides and difficulties. I think that's been a huge issue.
So how do you each foresee your practices changing?
I think for me, I would see that a lot of things are going to be enforced. So the question would be, is it to remain in the profession or leave? And then I think the biggest picture for me is where is God personally, and what is he saying? So my obedience towards him is the most important thing. Where do we place God in our decision making? Where is God in my personal life? Where is God in my employment? I think if we're able to answer those questions, it would be easier.
Now, I have a lot of hope in our practice that when the pandemic is over, we'll be past that and people will want to have joyful sexual lives again.
Make up for lost time?
Yeah, exactly. So, but we're in a little niche here, so let's get back to the good stuff kind of thing.
I don't know if this is a good thing, but the reality of just seeing, I mentioned so much increased substance abuse, increased mental health visits, and domestic abuse, child abuse. So we've seen so much more. Even when our numbers, our visit numbers were decreasing because people were afraid during the pandemic to come seek care, our numbers for those concerns actually increased, even from baseline, even despite that decrease. What I worry about in sort of the future, I see so many of these kids that have, at the beginning of the pandemic, 1/3 of the LA Unified School District, where the children were unaccounted for. And, I kind of joked to a colleague, I'm like, well, I know where they are. Like, they're coming in, we had young people on drugs, young people being trafficked, all sorts of just horrible things happening, gang violence, all of these things increasing and escalating. And I worry about, some of these kids were teetering on the edge anyway before, and then now in the isolation, and once you go down that path, it's so much harder to get off. And so I do, worry about a lot of our patients, but particularly the pandemic has hit disproportionately the most vulnerable populations, and I worry that the divide between the have and have-nots will be even greater, and the struggle is so just so daily and real, and that impact will have a ripple effect on everybody in the communities, and that's what I worry about, is just getting back. How long will it take for us to get back to where we even were before? We had issues before.
in terms of the young people, one of the things that seems to have happened during this time is that it has massively increased the use of their
electronic
stuff, because they were even more alone.
Right.
And so there's a kind of a getting hooked on that now, and how we'll come back from that after we get past the pandemic. That's going to be big,
these poor developing brains
with the kids and adolescents.
Yeah, that was one of our concerns from our questions, is that children especially have missed out on an incredible period of social interaction in this 18, 19-month period. And you can't get back those first 5 years, or you can't get back that time frame. So what are some practical ways that we can invest in what has been, I don't want to say stolen, but really been difficult to address in the ways that we typically have?
I would say that we have to be very intentional about when we think of what stage of development our kids were in during those 2 years and what would normally happen during that time, and then what they might have missed out on. We can't just, we've had the tendency to kind of just assume that development happens in its natural course. This was interruption in development. And so now we have to be very conscious, deliberate, and intentional to help them through some of those developmental stages that they missed consciously, rather than just knowing that it's going to happen because they're in second grade.
And probably they're in families where there's increased tension, increased stress, children that need even more attention than usual, are probably getting somewhat less, and that's...
Yeah.
Yeah, and if
challenge.
some grandparents are available they can fill in some of the interaction with these kids.
That's a good point.
Yeah.
Yeah, that the grandparents who are available
Yeah.
need to up their game and,
Yeah.
and get in there and be alongside them in this process of catching up with what they've lost.
Yeah, we see a role if we're willing to get outside of ourselves. We see a role for us to play. And I say that also in regards to the church. We know this has research, statistics all show incredible impact on our communities of minorities, Black and brown communities that have been disproportionately affected. The mental health and wellness, especially of our young, I know suicide has risen, and substance abuse has risen. And so in the midst of these, I just, we see these ripple effects that are really profound. Friends, what kind of advice have you received that has grounded you in this? And what kinds of, maybe a word would you give as we move through it?
Well, that isn't an exact answer to that question, but I was just thinking of how incredibly dynamic Daily Vacation Bible School was here this summer. And I wondered during that time whether that wasn't just a surge of families, these kids needing that, and what a wonderful opportunity, and taking advantage of those kind of opportunities in our communities and doing that, whatever it is we can do. And we certainly are in that grandparenting role and have done a lot of that during this 2 years, being there for our kids in different ways. So we know that, and that's so rewarding. We know we're making a difference. That's good.
I think it's human nature to think, okay, I should do, this and this and this, all these great big things,
Right.
but sometimes just
Little
taking a
things.
step. It's
Yeah.
a little thing, oh, I want to do something. So I'm going to, I'm going to cook for my neighbor, or I'm going to, just this small gesture. I'm going to buy coffee for somebody, text somebody, give them an encouraging text. That's something that's very tangible, very easy. That's a small, I may not be able to do this big plan today that I wanted to do, but I could just do a gesture, a small step in that, walk for 5 minutes. I can't, I would love to run for 2 hours, but I'm going to walk for 5 minutes, and that's something in the step, in the right step.
Whether that's reading a book to a 4-year-old or reading a book to an 85-year-old, either one.
Yep.
It's just, again, putting ourselves out and being there.
And enjoying, not losing the moment. That's one of the things I've been trying to be intentional about lately, is just, this is life, this is today. I tend to be, I've got my checklist, and I've got to get the dishes done, and I've got to do this, and I've got to submit this, and just stopping and saying, feeling the water on my hands and saying, this is life. I'm grateful for this moment. I'm so glad I have dishes to wash for a family that I love. Just stepping back and having some context.
Yeah, I think to add to that is self-care is very important. Unless we care for ourselves, it would be very difficult to care for others. So just to be aware of that and just to check in on ourselves from time to time and what is wrong, why am I feeling this way? Something is wrong, and just to look deep into ourselves. Then if we are at a better place, then it would be easier to extend a hand for somebody else. And for some of us who are able to help somebody else, our neighbor or any other, financially as well, just to put some money in an envelope and just drop it off. It's a simple gesture, but it may mean a lot for that somebody in need. And if we cannot do that, or even just having a list of names on your prayer list, and just praying over a few people a day, or who are in need, just writing names for God somehow to intervene in their lives for whatever the needs are. If you're seeing some people struggle, just praying for them would be a huge help.
I'm going to wrap us up with our last question here, and I don't want this to sound trite. I don't want to say we're going to wrap this up with a bow and just, walk out of here with large smiles on our faces when this is in some ways a very serious conversation that we're having. But one of the things that I am so grateful for as a follower of Jesus is that the narrative doesn't go life and then death and then end. It goes life and then death and then life. And that there is a sense of hope, and that there can be a sense of something coming out of nothing. And for me, the theology of Christ on the cross really grounds me in that though it doesn't prevent the suffering in my life, I have hope to walk me through that suffering, and that there's something on the other side. So in that sense of the word, is there a silver lining?
Yes.
Is there a life after the life and the death, which I know some of us here have griefs of people we have lost, people in our own families who have died. There's some tremendous devastations and tragedies that have weighed on us. But could we reflect on a bit of what are the stirrings of new beginnings after such a season?
I really do believe that God brings good out of negative situations, and that good will come out of this. And I know for us, it was kind of fun when everything shut down. I mean, at first it was like, wow, the seminars weren't happening, they couldn't, and all that shut down. And yet it gave us lots of time to be together, kind of like you said. We got stuff cleaned out, files gone through, all kinds of stuff, and did have more time to give to the grandkids and take on roles that their parents couldn't do because of their workload. And now we had freedom to jump in and make a difference. And so I do think good can come out of this. And we can learn how to handle better, I hope, differences that now they're so prominent and so out there in our face that we're going to have to develop skills for that, which I'm not saying I have, or that there's a lot to learn about how we deal with those kind of differences.
Yeah, that would be the direction of my hope also, and that we would come through this and recognize that the only way we can really work together as the human family, and specifically as the Christian family,
God's
is
family.
if we can come together when this is past, or even as it's going past. That would be my hope.
And we are not promised an easy life. There will be struggle in this life, and I think stepping back and having some perspective that this is our lives, our refinement. We are getting prepared for our eternal hope and purpose. And it is in the struggle that we grow the most. And I think we tend to assume, it's our natural inclination to think, life should be easy. God should provide for all of our needs. And he provides for all of our needs, but sometimes our needs are character growth. He's preparing us to be better. And I've known this to be true in my life, that God uses my greatest struggles, my greatest hurts, my greatest weaknesses. That's what he uses those experiences for me to help other people. And I think that having that perspective, like, okay, God's gonna take this horrible situation, this weakness or whatever, character flaw or whatever situation that happened, and he will bring good out of it. He will use me to help other people in their suffering. And that's the great thing about God, is he is this amazing way of bringing things full circle and bringing it to completion.
I think this pandemic, what it did to me is prioritizing in life, what is really significant and what is really important in life. Relationship, people are more important. God is significantly important. What I mean by God is not just the fact that we're going to church, that we're attending religious services, but having that really personal relationship with him and trying to listen to him despite the crisis, despite what's happening in our lives. And what we see, it's not just us who's in California who's affected. We're seeing globally people really even not having a burial place. What does it mean? So I think this crisis, what it did to me, or I would assume to so many others, is ask the biggest question. So is there life after that? And what are we supposed to do while we're on this earth? I don't think God brought us all to this earth, so we have a profession and we have work and we die and that's the end of it. I think all of us, each one of us, have a purpose why we're here. So really figuring out what that purpose is, and I guess that purpose is also being found by getting closer to him.
I think it's important for us to remember that we weren't promised that there wouldn't be trouble. In fact, we were told there would be trouble, but that God would be with us in that trouble. So if people say, why would God allow us to get the virus or get COVID? Well, that we could say that about every disease and every calamity and every earthquake and every fire. But we haven't been promised that the signs of sin are not going to be out there, but that we can count on it, that God will be with us in those situations. That's what we need to take away from all this.
God is with us, and we are the embodiment of God's love to others. And it is an invitation to be present to one another.
Yes.
You guys, we have sat here, we have ached over some of these injustices, we have wrestled with some of our divisions, we have been inspired by your professional expertise and just your experiences and your labors of love as you have worked with people from the intimate spaces to the emergency room. Thank you. Thank you for bringing this conversation to us to wrestle with these important things that we carry. And fam, I hope that you leave this evening encouraged. I hope that you have more conversations. You grab someone and you head out and grab some food and keep the conversation going. But that you would be inspired to get a great night of sleep tonight and do the bits of self-care that we have shared together. Not too much ice cream, he said.
You can if you jog to the car. Balance.
I feel certified for life to eat ice cream. This doctor just told me it's okay. You guys have a great evening. Be blessed. Thank you for joining our conversation tonight.